Hello, and welcome to the latest episode of Living with and Beyond Cancer. My name's Steve Poynton from Steve Poynton Counselling and Support. This is a podcast for people who have or have had cancer. As a twice diagnosed kidney cancer patient who has been in remission for 7.5 years, I recognise the trials and tribulations of what happens next once we've finished a treatment or are in long-term maintenance treatment and try and return to our lives. Before we go into today's episode, if you want to know more about myself and why I'm doing this podcast, please go back to episode 1, which was released on World Cancer Day on the 4th of February, 2026. So, welcome to this latest episode, where we'll be exploring the story and the message of Sharron Moffatt. Sharron is somebody who I've followed on social media for a while now, and I'm often inspired by some of the work that she is doing. Welcome, Sharron. Do you want to take the opportunity to introduce yourself?
Well, hello, Steve. Hello, everybody. How do I introduce myself? My name is Sharron Moffatt. Sharon spelt with 2 R's. I am a workplace trainer. I deliver a lot of talks around things like mental health first aid, but I also deliver a lot of talks and kind of information really to organisations about cancer as a whole. So if you're looking at a cancer diagnosis, people often think of it as a physical illness, which it is, it's a physical disease, but we forget about the long-term psychological impact. It rarely gets discussed. So that's the kind of bit I talk about. That's where I come in really. But I'm also a cancer patient. I should say that really, shouldn't I?
Well, thanks for that introduction. I mean, do you want to take us back to where this all sort of started for you, Sharon? I believe it's roughly around the end of 2023.
Yeah.
What was your sort of setup in life at that point? What were you up to? And how did this
Yeah.
all come
Well,
about?
I so what was I up to? Well, I was working, I'm self-employed, so I was delivering a lot of training. I do a lot of talks around kind of mental health and anything around well-being, really, which sounds really like, oh, another one, but I'm not an average speaker. I just say that. Um, so my mum had navigated breast cancer 3 times in her life and it metastasized to the lungs. And unfortunately, she died in July of 2022. The October after that, my dog that I'd had for 4 years, I adopt really old dogs. So I'd adopted Smokey at 10 and I had him for a wonderful 4 years and then he died. And there's a point of me telling all of that, by the way. So in December 2023, so 18 months later after my mum died, I was doing what every person should be doing, but we don't, is checking my chest. So for those of you that don't know, we should be checking our chest once a month for about 5 minutes, and you're looking for something that might have changed. And that includes men, people that are non-binary as well, because if you've got a chest, you can get breast cancer. Around 400 men a year get diagnosed with breast cancer. So it's rare, but it's absolutely possible. So in December 2023, I was checking my breasts, and can we call them boobs, Steve, by the way?
Call them whatever you like, Sharon.
A breast sounds so formal, doesn't it? I mean, I never call them that, so we'll call them boobs. Thank you. So I had just noticed that one of my boobs had got bigger. And to be honest, I thought, ooh, this is quite good. And I spoke to a couple of friends and said, since you started HRT, have your boobs got bigger? And they were like, yeah. I was like, oh, I'm not knocking that. So to be honest, I didn't really think anything of it. But something in the back of my mind was saying, well, do you know what? You're 48. Looking at my mum's history, maybe I should just go and see a doctor. So I did. And I went through that 2-week pathway where you get sent to the breast clinic. I had a mammogram and a biopsy. And again, if I'm honest, I didn't worry about it. I didn't think anything of it. I just carried on. Within that time, I'd also agreed to take on another rescue dog. So Rudy Sunshine is about 11 now. He was 10, never had a home. And as much as I was like, I'm not ready, I'm never doing it again, I can't resist a grey muzzle. So I said yes. So I was working with him, transitioning him into home life. I hadn't officially adopted him. And we had Christmas, forgot about everything really. I was really excited about welcoming Rudy home forever in January. And the 3rd of January 2024, I officially adopted Rudy. ITV came and filmed us. He's famous. He charges for autographs though, Rudy
Okay.
Sunshine. So ITV came to film us, and about a week later, I was in London giving a talk, and I was at the Shard in London. It's an amazing building in London, and I was going through security. And as I was going through security, my phone rang, and it was the breast clinic, and they said, "Can you come in today?" And I thought, "It's a bit weird." And I went, "Well, no, I'm in London." And they went, "Can you come in first thing in the morning?" And instantly I thought, "Oh, this sounds quite urgent." So I started to that's probably the first time I thought, "Oh, this sounds like it might be something." I delivered the talks, went home, went to the clinic the next day, and was diagnosed with triple positive breast cancer. So I was diagnosed on the 9th of January 2024. So I was on my own. Completely on my own, which I chose to do, by the way. But I also my instant reaction when they said it's cancer wasn't, "Oh my God, fear, what's gonna happen now?" My instant reaction was, "Well, I just won't tell anyone. I'll keep it to myself. No one needs to know." But why did I feel that way? Why was I so anxious about telling people? I'm self-employed, right? Will anyone ever work with me again? Will people treat me differently? I just didn't want people to look at me as a cancer patient and not as Sharon. But when I realized what my treatment plan was, I realized I probably couldn't keep it a secret. So I did what most people do. They don't all do this. I blurted it out on social media, as you do.
I mean, that's quite an interesting sort of journey, isn't it, already, that your focus is on the dog, the new income in the house, or the new incoming sort of feature in the house. Not really fussed about what might have found, even though I've got the thoughts about what's happened to my mum. And then all of a sudden, bang, it's there. Your life's changed. How do you process that, Sharon? And I know you mentioned sort of what your treatment plan was. What sort of was on offer? What were they suggesting to you?
So that first appointment, they didn't really say that much. They just said, "Yeah, it's cancer. We need to do some more tests." So they sent me for a CT scan. And the CT scan is what shocked me because, there was no lump, right? People always think breast cancer is a lump. Well, it's not. There are many different symptoms of breast cancer. Some people don't feel anything, don't even notice anything, particularly if they've got something called dense breast, right? So I looked at the CT scan and I was like, "Friggin' heck, that's 3 massive tumours." So in total, my tumours were about 12 centimetres. Now, I'm not very big, right? I have got a flat chest, so my whole boob was basically tumours. And I was just quite shocked that it was so much cancer. So that shocked me. But then they said, "You're gonna need at least 7 months of chemotherapy, mastectomy, radiotherapy." And I was like, "Oh." And that's when I cried. I was still on my own, but again, I didn't cry because I was like, What? The things that people think you're gonna feel, like, am I gonna lose my hair? What? My sole worry at that very moment were 2 things, and one of them was, what am I gonna do with my dog? And the second one was, how am I gonna tell my family? And telling my family was the hardest thing by far I think I have ever had to do. We'd only just lost our mum, 18 months before from cancer. Yeah, that made me more anxious than others. But as time very quickly started to move, as it does when you're first diagnosed, it's quick, right? Lots of
Oh,
appointments. The reality of, again, not the physical side of it, but daily life. Like, how am I going to look after my dog? How am I going to support my family who will also be struggling with this? But what am I gonna do financially? I'm self-employed, I don't come with a pot of gold at the end of my rainbow. I live a really humble life. I rent a house. I'm like, "What am I gonna do?" And that
it's interesting, isn't it? Because
yeah.
I hear a lot, and as I'm sure you do in your line of work, people who talk about that initial fear of the disease. I'm hearing from you it was the fear of everything around that, of
Yeah, it wasn't the disease.
keeping a roof over my head, basically, and above
Yeah.
all else.
I think I'd learnt a lot. My mum was a Northern Irish hardcore lady, full of love, and when the going got tough, she was outstanding. But the way she navigated cancer was a real learning curve for me. And she was like, you just put one foot in front of the other, you trust in the science, and you keep going. And I really felt that. So, I didn't go into cancer with fear of, am I going to die? I've never felt like that. I don't know why, because it's a very rational fear, but my fear were around today. But I wonder if part of that, Steve, comes from our dad died 25 years ago. He was 62. Loveliest man ever, big, friendly giant. Everyone loved my dad. Hard working. He worked so hard all his life, and he never got to see retirement. And that always stayed with me. And I think after he died, I stopped worrying too much about the future and started thinking, you've just got to live for today. Now, rightly or wrongly, that hasn't done me lots of favors. I don't have security around me financially, but I do try and live for the day. And I think maybe those two things kind of help me in a way. I mean, there is an element, isn't there, though, of like I'm burying my head in the sand, but one day at a time, I think.
That's, I mean, there's a lot written, isn't there, about you shouldn't bury your head in the sand, but it's a legitimate coping strategy, though, isn't it? Some people literally need to do that, otherwise it becomes far too much, it's too overwhelming, and then they can't see what's directly in front of them because they miss it.
Yeah. I can't look too far ahead. Whenever I do, that's when I become emotionally unwell. I live with a mental illness. I have done since I was 11. I've been incredibly well for the last 10 years, to the point where I haven't had any crisis or anything. Of course, I've had down days. We all have those, right? But if I stop to look at the future, then that's when I start to spiral quite quickly. So I just don't allow myself to go there.
I think there's something, I sort of diversifying for a second, I talk about in my counselling work, and in my speaking at times, about the past, present, and future. And
Yeah.
often people can't see the future because they're ruminating about the past and the fear and of things reoccurring and things like that. And we miss the middle bit. We completely miss the middle bit of today. And that's what life's all about, isn't it? The today.
Yeah, totally. And I don't feel I look back on the past too much. I try not to dwell on the past because the past is the past and you learn from that. That's taken me years to get to this point, right, though. I've struggled with my emotions all my life. But I can't look too far ahead either because you really don't know what tomorrow is going to bring. And like you said, you're missing today. And one thing that really helps me, and it sounds a bit cheesy, but it does help me, is finding those small moments of joy in your day.
Yeah.
Um, and I love nature, love it. Like I was talking to someone this morning, there's a big, massive spider in my conservatory, and I can't stop looking at it. And he was like, "How could you do that? How could you have a spider? Just let it sit there?" And I'm like, "Oh, it's fascinating." But I love nature. So this time of year particularly, seeing the daffodils and the flowers bloom, it just brings me a little bit of joy in my day. And it sounds really cheesy, but actually sometimes it's breaking things down into those small, tiny things that can really lift your mood and your day.
Absolutely. So you've mentioned potentially 7 months chemo. You've mentioned mastectomy. What
Yeah.
happened next?
So I had 7 months of chemo. I had a mastectomy with what's called an expander fitted. So I had a skin saving mastectomy. And initially I was like, just take it all off. I wanted them both gone. But they don't do that on the NHS unless there's cancer present in both boobs or you have a genetic mutation. I don't know anything about that yet. Still waiting to be tested. So I had a mastectomy, then I had radiotherapy, and you kind of think, "Oh, it's done, that bit's done, I'll start targeted therapy," but it wasn't, unfortunately for me. What happens is when someone has surgery for cancer, they send everything they've removed off to be pathologically tested to check that they've got all clear margins, etc. And unfortunately for me, I had what's called an incomplete response. So there was still tumour present. There was also a different type of cancer that had started to form. It was small, it was like a grade 1 ductal carcinoma, it's called. But so I ended up after that, and this is probably the bit where things started to maybe not get hard, but I was like, oh God, it's a bit of a shock. I had another 10 months of chemo that I
So
wasn't expecting.
so 7 months chemo and surgery, first of all, how as somebody who's self-employed, how did you go on there, Sharon? Because that's not easy for somebody who's even employed and gets part pay or sick pay or whatever. How do you work that? How do you
I
navigate
don't
that?
know. I don't know. I think, I wanted to work, right? I really wanted to work. I love what I do. I absolutely love educating people around well-being and now cancer. I love it. I love seeing the light bulb moments. I love seeing how people go on to actually use what they've learned. I thrive on it. So I wanted to remain in work, but I had to be realistic. And I think until you started chemotherapy, you've got no idea how you're going to respond, how it's going to affect you. What I will say is the first session of chemo I had, it was a drug called EC. Some people might know it as the Red Devil. And it's these massive, look like comedy plunger, big, massive comedy plungers that they inject you with. I mean, it's comical really, and it's bright red. And I spoke to somebody who also had triple positive breast cancer, and she had had this same type of chemotherapy. And I said, what was it like for you? And she said, "Oh, I felt all right on it. I went back to work afterwards." I went, "Did you?" She goes, "Yeah, I wanted to." And she played volleyball the next day. Now, the next day I was due to be delivering some training, and I'd spoken to the organisation and they were really supportive, and they were like, "Look, you can let us know in the morning if it's not possible and we will work with you." They were amazing. And I thought, "No, I'll probably be all right." My friend said this. Well, I wasn't all right. As soon as the chemotherapy went in my system, I felt ill pretty quickly. So in answer to your question, I don't know really. I think the thing that probably helped me is once I started to have treatment, and obviously I had 4 different types of chemotherapy drugs in total. So each one comes with new side effects and a new kind of pattern of those. Once I realized what my pattern was, and I did have a pattern, then I could try and work around that. And there were things like, say, for example, I was traveling. So if I was in London for the day, I couldn't do anything the day after. I'd be absolutely shattered. I'm still a bit like that now. So I just had to work around it, but I couldn't have got through it if it wasn't for the support of my family. I used most of my savings to pay for rent. And as
Yeah,
you will know, Steve, and many of your listeners will know, navigating cancer comes with extra cost. It comes with
absolutely. And
additional costs. According to Zurich Insurance, it actually costs somebody an extra £577 a month.
believe that. It's all the hidden
Yeah,
costs, isn't it, of transport to hospital appointments, parking fees, childcare that you might need. There's so many things in there, isn't there, that you wouldn't
yeah.
even have a clue about unless you've
No,
actually been there, and that's no criticism of anybody who doesn't know, it's just facts, isn't it? It's how it
yeah,
is.
and it was, I was very lucky that where I was having chemo, parking was free, but it wasn't free at the other hospital where I would have scans. So, but all my treatment was a minimum of 30 minutes away, and some days I'd be at 4 different hospitals or clinics having different appointments. So I'd be driving for about 3 hours just to each appointment and back. So there's a lot of petrol when you're not really working, you're trying to keep a roof over your head. So that was a cost. I would put Rudy would get looked after for a few days while I would recover from chemo. That's expensive. Dog cover's expensive. So, there were additional costs. But my mum and my dad always said to me, never worry about money. As long as you can afford to pay your bills, don't worry about it. And I could just about pay my bills, but only because I had savings. I've got no savings now.
We
I sound really, like I've got it all together, don't I?
but they're facts, aren't they? And I guess in a way, you're fortunate that you went into this with some savings, but now all the hard work you've done before has been taken away by what you've had to go through. I mean, were you able to apply for any benefits or PIP or anything like that?
Yeah, I got PIP. I got PIP. I got some universal credit. But, as you will know, and many of the listeners will know, universal credit doesn't pay your bills, neither does PIP. But they were a real welcome. But I struggled a bit with that because I've never been on any kind of benefit at all. I've been really independent my whole life, and I struggled a bit with that in the beginning. And I can't remember who I spoke to. It might have even been somebody at PIP, and they were like, "You are entitled to this. It's not like you're not entitled to it. So you should use it for what you need it for."
Do you think the sort of, I guess it's changed in recent years, and without going political, do you think the climate, the social sort of thought process about people who claim benefits push you to that mindset about feeling a bit guilty for taking it? And because I had a little bit of that when I claimed it, and I know there's people here who in the country who claim benefits that aren't really entitled to it or are using loopholes or whatever. But I know when I used to have to take sick notes in to the DWP office, I was told to sit down there and apply for jobs and things like that. When I've already got a job, I'm just off sick. And I just felt a bit, almost a bit of a criminal going in there at times, claiming
I
something that I
do.
wasn't entitled
Yeah.
to.
I mean, I think because it might be slightly different now though, but because you're navigating cancer and you're not well, you don't have to go into an office or anything. They find as someone that's self-employed, when we were navigating COVID, obviously self-employed people got support and you'd have to go to the office then. And you're absolutely right. They treat you like a criminal. It was horrible. And I would cry nearly every time I went and be like, I've been self-employed for 35 years, and through no fault of my own, the government's decision, I can't work at the moment, and you're not being particularly helpful. But yeah, but that's another story. But no, but in answer to your question, I think my guilt came from the fact that I probably grew up in a really hardworking environment. I got my first job at 14. I've worked really hard all my life, and it just felt a bit weird. And so, you probably relate to this, Steve, and I'm sure some of the listeners do when people say things like, "Oh, make the most of it. You can take time off." And I think it's very different from going on holiday to Ibiza. If only, right?
You can't even lift your head off the pillow at times, can you? Never mind enjoy your day
Yeah.
off.
I mean, beach ready, I am not.
Yeah. Extra 10 months chemo, how did that go? And again, how did you cope with the sort of side effects and fitting in things around work and things like that?
That was probably my hardest in a way. Hardest, maybe not, but very different because I thought I'd finished treatment. And the chemotherapy drug that I was on for 10 months is one, it's called Kadcyla. And it's kind of sold in a way to kind of make you believe that the side effects are not that bad, and most people, it doesn't affect their daily life. That's kind of how it's kind of spoken about. So it's chemo, but it's not really chemo. It is really chemo. You're still in a chemo unit. You've still got a PICC line in your arm. You still have to take medication to counteract the side effects. And for me, I was really unwell. I don't talk very often about the really tough bits of my treatment purely because I think if people want to find that stuff, it's everywhere. And, cancer is so unique. It's like a fingerprint. And so are the way we respond to treatment. I never want people to be frightened. And we live in a world where you say cancer and instantly it drives fear. But for me, this particular chemotherapy was horrible. And I think probably my body had been through a lot, right? It'd already been through a lot. I was really ill at the beginning. I had a really bad, they don't know what it was, virus infection. I was in hospital. I felt awful. I got blood clot in my arm from the PICC line. I'd lost a lot of weight to the point where if I didn't start eating, they wanted to feed me through a tube, and they were like, "If you don't If you lose any more weight, we have to stop treatment. I was really unwell, but everybody was like, "Well, you rang the bell last year. You're all right now."
Mm.
And for me, it was tough. But once I kind of got around all of that, because everyone was like, "Oh, you're back working now." And I have worked more, but I still have to be incredibly mindful of, okay, so I can do this today. That means tomorrow I have to be at home and, I might do some writing or producing of talks or something. But really, if I travel, then I'm pretty out of it the next day for sure.
Just want to pick up on one of the things you said there about the ringing of the bell.
Yeah.
I don't want to take away the significance of ringing that bell for somebody because it's a magnificent achievement to get through to the end of treatment. But a lot of people who aren't patients see ringing the bell as that's it, it's finished, done.
Yeah.
You're recovered, you're over cancer, get on with your life. But it doesn't
Yeah.
resemble that, does it? It resembles you have finished your treatment.
Well, you finish chemo.
Yeah,
'Cause I knew I hadn't finished treatment, but I wouldn't have rung the bell. I didn't really wanna ring it because I knew treatment wasn't completely over. I already knew that because I was gonna be going on some kind of treatment. I didn't wanna ring it, but the reason I did was my family were really excited, so I rang it for them, and I also rang it for the other patients there because I know what it's like when you're going through treatment and you think, "Am I ever gonna get to that point?" So I rang it for them. But I rang it again when I finished the 10 months of chemo. But again, I wasn't gonna ring it, but my brother-in-law and my niece turned up on my last appointment. So I was like, "I better ring the bell then." But I wasn't, I didn't wanna do it for me. I wanted to do it for everybody else, because I knew treatment wasn't over, and people have that misconception, don't they, that ringing the bell, because there's that rhyme, isn't there, when you ring the bell of "My treatment is done, I'm on my way," and I'm like, "It's not. Chemo's done, but treatment is rarely done," like, I'm still on treatment now. I'm classified still as a cancer patient, and that still comes with side effects.
yeah. It's really interesting how you say you sort of did that for other people in the wards, and I see that a lot of your social media work and things is obviously aimed at helping people. And something you did sort of in the middle of your treatment was for Macmillan. You want to tell us a
Yeah.
little bit about that?
Well, it wasn't at the beginning, it was quite close to the beginning. So I started chemotherapy at the very beginning of February. I tried the cold cap. For the people that don't know, obviously the cold cap is -18 degrees on your head, and you have to wear it for a period of time before chemotherapy and keep it on afterwards. And the aim, despite what people think, isn't necessarily to keep your hair, it's to protect the hair follicles. Because some people can have permanent alopecia from chemotherapy, some particular types. So I thought, well, I may as well give it a go. It's being offered to me. But I was so ill on that first chemotherapy treatment. I thought, why would I sit here for another hour and keep this freezing cold cap on my head when I can go home? So I made that decision there and then that I wasn't going to continue. So I had my hair cut short. For people that obviously can't see me, I have naturally long hair. So I cut it short and I decided, well, do you know what? If I'm going to take control somewhere, I'm going to shave it off. So I shaved my hair for Macmillan. They do a fundraising event called Brave the Shave, where you shave your head and raise money for Macmillan. And I was really gobsmacked because I raised £3,000. I'm like, how did I do that?
Amazing.
And I was really grateful for everybody. But it felt really, I don't know what the word is it cathartic, like shaving my own head? I felt a little bit of control. But for me, and this isn't for everybody, the thought of waking up every day thinking, "Is there gonna be hair on the pillow? How much hair is there gonna," that just wasn't for me. And
Right.
actually, I shaved it not to completely bald, but to a grade 1. But even when the grade 1 started coming out, it was painful, it was prickly, it was itchy. I was like, "Just get rid of it all." So I shaved it completely then, yeah.
Okay, so I mean that's an amazing amount. Well done.
Well, it was not me, it's all the generous people that donated. I was
Yeah, but
honestly
you've got to do the thing.
gobsmacked.
You've got to do the thing, and you've got to actually sit there and have your hair shaved off. And I know from
Looked
working
like
with
a
people before.
potato.
Yeah, I mean, it's taking control, and that's big, isn't it? And as a counsellor, I understand and hear that a lot. But I know certainly for a woman to shave your hair off, that's a big call because it's
Do
affecting
you
your whole body image.
Yeah, can I be honest? Do you know what's harder than
Yeah, go
that?
on.
No eyelashes.
Right, okay.
That's one of the hardest things, and mine have emigrated. I don't know where they've gone, but they have not come back. So I found the eyelashes harder than the hair. Don't know why, but I did.
So after your 10 months of extra chemo, and you mentioned you're still sort of classed as a cancer patient now, where are we?
Yeah.
Where are you up to, Sharon?
So after I finished this lot of chemotherapy, I had a break. Then I wasn't very well. I think I had COVID, and it had knocked me for six, really. My immune system was still shot to pieces, really. My bloods, I was still having blood tests, and my endocrine system was a bit all over the shop. For those of you who are listening that have had chemotherapy, maybe other cancer treatments, we have blood tests regularly to check that we're well enough to have the next treatment. And my electrolytes were always all over the place. So I had a break. Then I was put on targeted therapy. And in my case, aromatase inhibitors. And the idea of aromatase inhibitors is to block estrogen production. So I had triple positive breast cancer. That meant my cancer cells were estrogen, progesterone, and a hormone and a protein called HER2 receptive. So the idea is to block those hormones so the cancer cells can't latch onto them. And I wrote a post about this today, actually, that a lot of people think, oh, well, HRT causes cancer. You shouldn't take HRT. This isn't that, right? So if you think that the cancer cells have a lock on them, the hormone is like the key that unlocks it. So the cancer can then almost get permission to grow. So I was on those. My body hated them straight away, the first lot. And if I can be honest, I went to a very dark place very quickly. And I knew that wasn't my mood. I knew that was something outside of my control, really. And I had this rash all over my whole body, which sounds like I'm being over dramatic, but it was like severe sunburn all over my whole body. But when I say all over my body, Steve, I mean in my ears, in my scalp, on my feet, like everywhere. So I was on fire, but I was also really itchy. So I stopped that and I had a break, and then I started another type of aromatase inhibitors. And although the side effects, some of them aren't as severe, others are still not nice. So I still have the rash. Like I'm sitting here talking to you right now, Steve, and my face is on fire, and all I want to do is scratch my face off. Thank God for makeup, right? Yes, I have got makeup on. Sorry, everybody, but going without that is not an option. Mr. Potato Head is not in scene today. Yeah, so the rash is probably the thing I would say that is most frustrating, but the usual hip pain, can't sleep, I'm losing weight, which I don't, never in my life did I think I'd get into trouble for losing weight, but here we are. We spend all our lives, don't we, going, oh, I just lose a few pounds, I just get a few pounds off, and now I'm like, I need to eat.
Yeah.
So I'm at a point now where I'm like, do I continue or don't I? And I'm just not really sure. If I can say that what happens for someone that's had breast cancer is your medical team will use a system that's called Predict, where they put your type of cancer, all the treatment that you've had, your responses. So, did you have complete response, not complete response? And the Predict tool will tell you the benefits of any additional therapy. And for me, it came out as a 9% additional benefit to taking aromatase inhibitors. Now, that doesn't sound a lot, but actually, that's quite high. Most people, it would come back at about 2%. So I just don't know. I think if it was down to me, I would stop. But when I look at my mum's history, who had cancer 3 times, and I think of my family, it's not just me I need to think about here, it's them. Because if it was just down to me, I'd stop.
Yeah.
But I need to think of my family, really. And for y as you will know, Steve, and anyone who knows, who is lucky enough to be close to their family, you'd go through the trenches, wouldn't you, for them?
Really, and I don't know if you know, but when I was initially diagnosed, I had a 2-year-old and my wife was 14 weeks pregnant.
Wow, I didn't know that,
That
Steve.
that was an interesting
Oh
time,
my
to
gosh.
deal with all of that, but my surgeon said to me, "She's 14 weeks pregnant now, by the time, she's 20 weeks pregnant, this'll all be over." And by
Right.
that, he means the tumor would have been removed. I had my whole kidney removed. And he was nearly right. 21 weeks and my tumor was done and I was up and on my feet. I had complications 18 months after that, but he wasn't to know that. But yeah, it's difficult, isn't it, when family's involved and you making
Yeah.
decisions, especially for them. And I guess the question I want to ask you, Sharon, is you work a lot around mental health. You
Yeah.
mentioned mental health issues for you before this.
Mm.
What sort of support were you given mental health wise?
Oof. How
Anything?
long have you
Nothing?
got? So my experience of mental illness has been a very long one. Um, I was born in 1974, and I first started getting what we would now know as symptoms of depression and anxiety when I was 9. But back then, it was the 80s. No one talked about mental health. Children didn't get depressed or anxious. That didn't exist. It just didn't happen. But my mum knew. I don't know how she knew, but she knew that this was quite serious. So she advocated for me big time. And I didn't know this, but she said that we actually went to about 13 different doctors, and all of them would say I was attention seeking, I was a hypochondriac, I was lazy, all the things that you can imagine, right? But eventually, my parents took me to Great Ormond Street Hospital, and I never knew this, but they paid for that. I don't know how my parents paid for that. We were cutting the P voucher out of the newspaper type family, but they paid for it. And I was diagnosed then with chronic depression and anxiety. And this next bit really shocks me because the medical notes say that it was the worst case of depression and anxiety the psychiatrist had ever seen. And I'm like, really? But if I'm honest, I don't think well, I know it wasn't, but I just don't think they saw it in children, and I don't think they realised it existed because children were labelled as something else. But that diagnosis meant everything to me. Diagnosis isn't for everybody, right? But for me, it changed my life because it meant I was believed.
Mm,
And I went onto medication straight away. I was 11. And again, I thought medication meant fixing. I didn't realise it was like a life jacket. You've still got to swim.
yeah.
And I had lots of therapy over the years, most of which I didn't find beneficial. But I always, when people say, you probably get this, Steve, as a counsellor, people go, oh, therapy doesn't work for me. It's not for me. And I'm like, it's not that the therapy doesn't work for you. It's that the therapist you just didn't connect. I always think finding the right therapist or counsellor is like finding a lifetime partner. You don't
Absolutely.
always get on with everybody. And sometimes you have to see the process through because we're not always going to like what people tell us because it's like holding a mirror up in front of you, right? But the thing that really changed my life when it came to therapies was actually cognitive behavioral therapy. And I didn't ever have that till I was about 40. I was in really severe crisis when I was 38. I was under the mental health team. It was horrendous. The way I was treated at work was horrific. The shame I felt almost killed me. But I had cognitive behavioral therapy after that, and it absolutely changed my life because I stopped looking at the past of why me? And when I say why me, I don't mean like poor me. I mean, well, why am I struggling with this? And my twin sister doesn't. And everyone is skipping into school all excited and happy. And I'm wetting myself because I'm so scared. I stopped looking at that and started looking at what can I do today to make things better, just that little bit easier.
Yeah.
And that changed my life.
And that's
Yeah.
really important to sort of emphasize what you've just said about your relationship with your counselor and modality of counseling. Just before I trained to become a counselor, I'd had some CBT. I didn't personally like it, But what I thought, but at that point, I was very naive, so I thought, "Well, that's a load of rubbish." But when I trained in
Uh,
my modality of, person-centered counselling, I've now added other bits and bobs into it, and some elements of CBT which I've added into it. I realised very quickly that we're all different, and we all
mm,
need different things, and
yeah.
yeah, there's absolutely a place for CBT in it, and you are right, those that don't want to explore why, because sometimes, let's be honest, there isn't a why, it just
No,
is.
I didn't wanna do that. I was sick of going over, when you sometimes I go and see a cat, they go, "Tell me about your childhood, tell me." I don't wanna talk about that. That's not my problem. So, yeah, I hear you. But do you know what? There's only really one major thing that really changed for me in cognitive behavioural therapy, and it was 2 things. The first thing was the, ABC model of thinking, which I'm sure you'll know about, Steve, we can talk about in a moment. And the second thing was the 5-minute rule. Changed my life. Because on those days where it's too exhausting, I can't face the world, I can't get out of bed. And for anybody listening that's ever experienced depression, when you say you can't get out of bed, it is not laziness. There could be a pair of Louboutins in my back garden and I wouldn't have gone and got them. The 5-minute rule gave me space to, do you know what? You don't have to survive the whole day, Sharon. You don't have to get up. You don't have to have a shower. You don't have to get ready. You don't have to put on a mask of being okay now. All you've got to do is get out of bed. And you know what? After 5 minutes, if you need to go back to bed because that's too much, you go for it. And it
Yeah,
gave me permission to progress.
yeah,
And the ABC model of thinking really worked for me because I think I am a bit of a catastrophizer, really, and I worry what people think. So, for those people that are listening that don't know what I mean by the ABC model of thinking, the A is the action, the B is the belief, and the C is the consequence. So, say someone sends you a message on WhatsApp, right? We all get messages on WhatsApp, don't we? Oh, sorry, you send somebody a message on WhatsApp and you can see they've read it. It's got 2 blue ticks. They've read the message, but they don't reply. Now, that's the action. You can't change that action. But the belief could be, I've upset them. They don't like me. I'm not important because they're not responding. That's your belief. What's then the consequence of that belief? Well, you might stop messaging them. You might become insecure. You might start thinking you're a bad person, that no one likes you, and spiral.
right,
But a belief is only a thought that you keep thinking.
yeah. I
Only a
wholeheartedly
thought you
agree
keep
with you.
thinking, so change the belief. Because how do you know it's true? Because how many times do we get messages on WhatsApp and we don't we forget, we don't even reply?
Yeah, you're dead right, and it's a model that, yeah, although I'm not particularly a CBT therapist, it's really valuable, isn't it? And I would probably come at it as a person-centered counsellor a slightly different way, but the essence of that is
Yeah.
dead right, dead right.
Well, I'm like, I think that's right, I'm talking to a counsellor here, but
No,
anyway,
you're right, and
that's what helped me.
but I guess where I would potentially come at that is the sort of belief. We get into a bit of fear, don't we, sometimes when you say, "Oh, have I upset them?" or "What's happened?" Oh my
Yeah,
word, and
yeah.
your mind runs away with you until you've got the unknown
Yeah,
known, difficult, and I guess I hear that a lot when it comes to scans and things like that, and that's where I did a literature review when I retrained to become a counsellor, and I did it in mental health and depression in a cancer diagnosis, and I think it's really interesting you've brought this to the table about depression because I think, and I found that a lot of sort of people who need mental health support with a cancer diagnosis get lazily labeled as anxious or depressed.
yeah.
And it's not. They're conditions in their own right, and they are
Mm,
serious conditions. But if you can work with a cancer patient around their fear of the unknown, fear of progression, and fear of reoccurrence, that could be a game changer for those people. They're not depressed, they're
yeah,
worried like hell that they're gonna
yeah,
die or that they don't know what the next scan's gonna say or they don't know how they're gonna put the meal on the table because they can't afford it. I
yeah,
think yeah, it's they are conditions in their own right, and I think a lot often gets lazily lumped
yeah.
under it.
And I think I'm a bit, I mean, I don't, can I ask, I'm gonna, if you don't mind, I'd like to ask you what you think of this though, Steve, because I don't know why. I don't know. but I don't feel scared of scans or the what ifs. I don't know. I never did. And I don't know why. It's not because 'cause I'm this brave superhero. I just think, well, if it is come back, then we'll deal with it. Aren't I lucky to be having a scan? Because actually for breast cancer, if they've removed the tumor and you've had all your treatment, it's not actually protocol to have more scans
Yeah.
because it doesn't improve the outcome, and I find that really difficult, but I've never been really petrified. Like, I just had a mammogram recently and, someone said, "Are you scared about the results?" I was like, "I haven't even thought about it." Is that a bit weird, Steve?
No,
Am I a bit
it's obviously
weird?
no, it's your coping strategy, isn't it? It's the way you deal with it. You've obviously boxed that off somewhere, I guess, and
Yeah.
you understand that whatever the outcome, you'll deal with it. And I guess I've got a little bit like that these days. I had a scare last year which woke me up a little bit.
Yeah.
But you do get a little bit blasé as it goes on and sort of relax because you've had a sort of a
Yeah, I
flow of
don't
okay news. But I remember when I got sort of diagnosed, I was worried about what was coming. But once I had a plan, I was fine. Once I knew what
yeah,
the plan was, absolutely
yeah.
fine.
I just don't know. I mean, I was never, even when I had my first scan, even, when I first got tested for cancer, I wasn't at home worrying about what if it's cancer. I just, maybe I did just box it, but I think in the back of my mind, I thought, well, if it is, it is. Yeah, I don't know. Because I'm not, I think a lot, I mean, this is my negative head talking in my mind, which it does quite often, but I think I don't know, there's nothing amazing about me that would make me think that way. Like, I get messages every day from people that are petrified of, I haven't booked a mammogram yet. They're 50, that they're eligible for screening, and they're like, I'm 53 now and I haven't booked it because I'm so scared, which I totally understand. But I think my mindset is I'd rather know than not know because the treatment
Absolutely.
options are always better.
And we are all different, aren't we, ultimately, in the day, and we
Totally.
process things different, and that's why
That's the
different
beauty of
styles of
cancer, isn't
counselling and
it?
yeah, and that's why different kinds of counselling works for different people. So,
Yeah.
you obviously came to my attention on LinkedIn, where you're very active. What inspires you to do the work you do? And I'm aware you've gone over some of that, but just to sort of recap as we come towards a close, really, what's your goal? What are you hoping to achieve out about what you do, Sharon?
2 things really. The first is that people aren't stop being so scared of cancer, because cancer is scary, right? Of course it is. But what's scarier is ignorance and not knowing, right? That's far more scarier in my view. But the second thing is, if we relate, I always relate, and I don't like to compare. I don't mean to compare it in the way that it might come across. But if you think about mental health, 10 years ago, we still weren't really talking about it. The mental health conversation was still really quiet. Now everybody's talking about it, almost to the point where people are getting a bit kind of fatigued by it. So cancer is being spoken about all the time. In the workplace, in the park, in the pub, we're all talking about it. We've come a long way in the things that we talk about. We're only just touching the surface. But cancer, don't talk about it. We just don't talk about it. Workplaces don't talk about it. We don't talk about it as human beings. Unless you open TikTok and it's full of conspiracies. We could do a whole new podcast about that. So my aim is to educate people and create better understanding. One of the things with that I am really passionate about is for people to understand that cancer treatment is unique and we do not all experience it differently. And the stereotype that you think, because most of us do, if you open Google and put cancer patient, you're not going to see someone that looks like me. You're going to see a middle-aged white woman wearing a headscarf looking out a window.
Wow.
And if we only look at cancer patients in that way, we are making so many other people invisible. So yeah, workplaces need to step up, in my view, to educate their teams on understanding cancer.
Massively important, isn't it, in an area that's really difficult? And I know I touched on with you earlier on about the stresses and strains of employment tribunals, but
Yeah,
goals have got to be to stop getting to that point. We can't employment tribunals, yes, they need dealing with, but we've got to get employers better educated about how to support somebody who's going through cancer.
And it's not just employers though, it's colleagues as well, like,
Yeah,
the cliche remarks, the avoidance because they don't know what to say. None of it's rocket science, but we are so frightened sometimes of saying the wrong thing. We don't say anything or we feel uncomfortable or we portray our uncomfortableness onto the person. But, if I could share my inbox, we said this before we went live, Steve, on some of the comments I get from people around how they're being treated at work is just ludicrous to me. But they're so scared of saying anything because they need to put food on the table. That's
yeah,
really heartbreaking,
yeah,
particularly
it is.
when legally they are protected.
Yeah, absolutely. And we're going to hopefully do an episode of the podcast around your sort of rights and at work and with an employment law
Yeah.
solicitor, hopefully at some
Oh,
point.
brilliant.
So,
Yeah.
Sharon, thank you so much for your time today, for being so personal with your story. I'm sure our listeners won't fail to be inspired by what you've said today. If you want to know more about you, Sharon, how can they find out about the work that you do?
Well, what I will say, and I guess I shouldn't really say this, but the work I'm winging it on social media. Steve, you've made me sound like some kind of social media guru. I am not. The best place to find me is LinkedIn. I'm very active on there, aka winging it. So you can find me on there, Sharon with two R's, Moffatt, Moff for Freddie, A T for Toby. You can't miss me. And yeah, reach out. I'd love to connect with people.
So, if you want more information about the services I provide, such as the counselling and the public speaking, please visit my website, which is www.stevepointsoncounsellinandsupport.co.uk. And I'd also love to hear from you. What subjects would you like to hear about on the podcast? What have your struggles been? Would you like to come and share your story and your struggles on the podcast? Reach out via email at info@stevepointsoncounsellinandsupport.co.uk, or you can find me on any of my social media channels. Thank you very much for tuning in today, and I will speak to you all soon.